us see, define the cerebral palsy. Cerebral palsy is a group of neurological disorder that affect the movement and muscle tone and posture. It will be mostly it's affected the movements and muscle tone and posture. It's mainly caused damage to the developing brain. Often before birth or on birth, it's after the birth, it will be affected the brain. Okay, let us see what are the types in the cerebral palsy. First one is the spastic. It's a common one. More than it will be affected 70 to 80%, increasing the muscle tone and stiff is tightness of the muscle. These are the signs and symptoms present in the spastic type. Second one is the attitoid. There it is less one is 10 to 20% affected is uncontrollable movement. When we try to get or pick the things, is we can't reach it in the perfectionly. That is the attitoid type. Then ataxia types. It's a rare one. It's 5 to 10% only. It's affected. Uh, Difficult with balance and coordination. Difficult to balance and the coordination. The other one is mixed type. Is a 10%. The symptom of more than one type is there. It is a mixed type. Sometimes it will be affected the muscles or the tone and the stiffness of the muscle. Sometimes it will be affected the movement. It's difficult to balance and coordinate. Anyone it will be affected. That is mixed type of the cerebral palsy. Then types of cerebral palsy, there is a monoplegia, hemiplegia, diplegia and quadriplegia. Monoplegia means you know that there it is affected in the one limb, any one limb, upper limb or lower limb, any one limb there it is affected in this condition. Then hemiplegia. Hemiplegia affected the one side of the body, maybe arm, leg and the trunk. Then diplegia is affected symmetrically part of the body, legs or arms is both will be affected. Then quadriplegia is affected the all four limbs, the upper limb and the lower limbs and the trunk and body it will be affected. Okay, important features of the cerebral palsy. Okay, let us see one by one. The motor impairment is a difficult with the movement and coordination. Then muscle tone and abnormalities can be too stiff. That is other name is called the spasticity of the muscle. Too flappy. There it is a hypotonia. What is hypo? Hypo means is a decrease in the muscle tone. Then postural issues, problems with balance and position. Then other features non-progressive. The brain injury does not worsen over time, but symptoms may change the children grow. We can see it there. It is a symptom change while the children is growing. These are the main features of the cerebral palsy. Then warning sign. What are the main warning sign in affected the cerebral palsy? 0 to 6 months. Warning signs in the poor reflexes and the muscle control. Baby seems in stiff and floppy. Compared to normal, that children they are very stiff and floppy. Then intensive and light of the sound. Then trouble moving to his ear eyes. It's difficult to there it is movement of the eyeballs. Isn't the smiling? The smiling by the 3 months. They will start normally. Usually there it is a 3 months. These children they will be affected. There it is a changes of the this duration. Then 3 to 6 months. What are the changes present in the children? Warning signs in the CP child. Okay, there it is a reaching and handling the object. It is a difficult to handling the object and touch to reach the object. Not it is rolling over the sitting. Where it is a difficult, they should maintain that position, the only position. It's very difficult to do rolling and the over or sitting position. Then what are the changes present in the 6 to 1 year? Cannot grasp, cannot grasp, and trouble learning to self-feed and swallowing. There it is a difficult to intake the food. It's a difficult one to the swallowing. It's everything seems in the unfamiliar. Then favor or side of the body. In which side there it is a favor, they can maintain that position only. Then 1 to 2 years. Compared to 1 to 2 year, what are the changes present in the cerebral palsy conditions? Muscle spasm and the jerky and the stiff movement. The movement does not is freely. Is there. It is a difficult and stiffness of the movement. That underdevelopment and vocabularies is unclear vocabularies. We can see when we teach learn the children, there it is unclear vocabularies. Let us hear that one. Then lack of the coalition of the others and doesn't the play. It's not mingled to the other children. It's difficult to play, to join the same age people, 1 or 2 year age people. It's difficult to mingle that children. Then etiology. This causes, main causes is divided into three: is a prenatal, natal, or the postnatal. What are the causes, main causes to get the cerebral palsy? Then let us see. First one is the prenatal cases. Is before birth. Before birth, what are the causes to produce the cerebral conditions? The maternal infection. You know that there it is an infection, the rubella and the toxoplasmosis. These are the infection. It will be affect the brain. So there is a chance to get the cerebral palsy. Then placental insufficiency. There it is a insufficiency of placenta. There is passes through the food and vitamins from the mother to the baby. It's a insufficiency. There is a lack of deficiency. It will produce the CP. Then congenital brain malformation is a congenital disease, malformation of the brain. Then radiation exposure, sometimes the condition they face the repeated exposure of the radiation, it will get the, there it is a chance to get the CP. Then genetic abnormalities. It's a genetic disorder. It's then prenatal causes. During the birth, there it is a causes to produce the CP. Then birth asphyxia. What is that? Asphyxia means lack of oxygen to the brain. Then complicated or premature delivery. Is a complicated, is there is a premature delivery. What is that? Is a normal month. There it is a 9 months and the 1 week time. Before that, there is a chance to get the baby. There is a problem to produce the undevelopment brain is causes of the cerebral palsy. The neonatal stroke during the birth, there is a stroke. There is a chance to get it. Then low birth weight. The weight is less than the normal weight. There is the chance to get it the cerebral. Then postnatal. Postnatal means after birth. There it is a cause to meningitis. There is an infection to the brain. Then encephalitis. There is a chance. There is a CP. Then head trauma is fell down or any abuse. There is a chance to on the trauma on head. it will affect the brain, there is a chance to get to the CP. Then severe jaundice is more chances to get it the. These are the causes in the prenatal, natal, and postnatal complications. There it is a types of cerebral palsy. Let us see one by one. Then spastic, there is it is a spastic CP, cerebral palsy. There it is a most common one is a stiff muscle and over to the movement. It's difficult to the movement. There is a stiffness in the muscle group. Then dyskinetic CP. There it is involuntary movement including the dystonia and chorea. The uncontrolled movement present in the type of CP. Then ataxic. Ataxic means difficult to the movement is the problem with the balance and the coordination. Then mixed type. Any one signs and symptom present in this the type. The combination of two or more types. What are the changes present in these types? The types of cerebral palsy. Already we discussed the spastic and appetite, ataxia and mixed type. Which percentage it will be affected, we have discussed well. So there it is a changes present in the spastic, then increase the muscle tone, stiffness and the tight muscles present in the type. Then appetite, there it is a uncontrolled movements is signs present in the appetite types of CP. Then ataxia. Ataxia means difficult with the balance and the coordination. Mixed one, there it is any one of the any one or any two of the types is signs and symptom present in this group. Is a 10 percentage only symptoms of more than one type. Okay, we will discuss the spastic cerebral palsy. There it is common one. Most of them children it will be affected this type of the uh, uh, cerebral palsy type. The muscle there it is in these are the signs and symptoms present in which one is there it is a muscle stiffness. Stiffness means spasticity of the muscle. Then increasing the muscle tone and reflexes can be affect one limb or four limb. Where it is a, according to the types, it's a quadriplegia, diplegia, hemiplegia, it will be affected. There it is a one limb or two limbs, there it is affected common on in the four. Then second one is the dyskinetic, the other name is called attitude CP. The involuntary movement is a twisting and there it is then affects the face, limb and trunk. These portions mainly it's affected in this type of attitude type of CP. The muscles may they between the tense and the floppy. There it is no there it is no tone. The muscle its weakness is let us see there it is a floppy. It's hanging there it is a no power that muscle. And what are the types that it is affected the cerebral primary? Then brain, in which area there it is really affected? What are the signs present in the cerebral paralysis? First one is the cerebral cortex. In which area there it is a cerebral cortex, it will be affected. Let us see, these are the features present in the baby. Stiff muscle, there is spasticity. The associated damage or development is a difference in the condition. Then second, that area that there it is a basal ganglia. It will be affected. This area is uncontrollable movement, dyskinesia associated with damage to the basal ganglia. Then third one is cerebellum. The brain, there it is a part, it will be affected in the cerebellum. Let us see, these are the signs present in the children: poor balance and coordination, then associated with the damage to the cerebral. Then final one is multiple area of the brain. The damage to the not only particular part, there will be affected the multiple part or multiple area of damage to the brain. It's a mixed one to combination to more than one types to associated with the damage in the multiple area of the ataxia type affects the balance and coordination. Then shaky movement and difficult to precise to task. We can ask the patient to do it, try to writing, they can't do it, it's a difficult one. There it is a shivering, that is a shaky movement, they can't write it in perfectly. Then mixed type combination of spastic appetite or ataxic dyskinetic symptoms mixed, it will be proper CP. What are the major signs and symptoms present in the cerebral palsy? Developmental delay. Example, not sitting and walking and expected the age. According to the age, there it is a month, they can do it the movements. In every month, there it is a different milestone, they can achieve the children. We couldn't see it this condition, developmental delay, not sitting and walking and expected that the age or the month. Then abnormal muscle tone, too stiff and compared to normal child, there it is a muscle tone, there it is stiff and floppy. Sometimes there it is a hardness of the muscle, there it is sometimes some conditions, there it is floppy awesome, very loosening of the muscle, there it is no tone, there it is no power of the muscle. Then poor coordination and balance. Let us see the children try to sit and walk and crawling. Let us see, there is a poor balance and coordination there. Moreover, the coordination when we try to reach the things or try to catch the things, let us see, there it is a poor coordination, we can see it. Then involuntary movement. So involuntary jerky movements are present in the during the movement time. The poor posture, they can maintain which there it is dominate the position, they can maintain that position. There it is see that children is poor posture. Then gait abnormalities while they walking, let us see, there it is abnormalities in the gait. The feeding and swallowing is a bit difficult, they can eat and the swallowing in that things, there it is very difficult to do it. Let us see these signs and symptoms in the patient. The speech and communication problem, we can ask the patient to a simple vocabulary. For example, we can teach the apple like that. It's very difficult to present in the cerebral palsy children. Then associated condition, the seizures, there it is involuntary movements, and the 30 and 50 percentage it has done in the condition. Then intellectual disability, then vision and hearing problem, the associated problem, there it is any sight or the hearing problem, that's also. The dental issue, then behavior and the emotional challenge, there they should not maintain the emotionally normal, so it's mood shifting behavior, we can see it in that children. Learning difficulty, you know that when we teach or ask the patient to try to learn and the speak, it's very difficult to want to do it. Then orthopedic issues and scoliosis and contracture. So when we see the alignment of the spinal cord, let us see its deviation, whether it is a right or left side of the spinal cord curvature, that is the scoliosis. Then contractures that is present in the joint structure. In the TA especially, for example, the TA, the tender Achilles, that it is a tendon, it's a very stiffness and they very difficult to move the steps in properly. Then speech and communication problem. When we teach and try to do it to the children, it's very difficult to do it to the speeching. Then seizures, epilepsy, there is a signs and symptom in the fits. Then diagnosis, clinical evaluation of motor development and reflexes. Then MRI CT scan of the brain, we can see it, the identify of brain damage and malformation. When they see the MRI and the CT can report, let us see there it is a damage in the brain, any formation, malformation, unusual formation in the brain, let us see that. Then EEG, if there is a seizures and suspected, if there is a neurological defect, there is a fits, we can suspected, let us see in the EEG. Then metabolic and genetic test to diagnose it are unclear. Diagnosis unclear. Then developmental screening test. Developmental screening test is a milestone. We can measure that the children in which that is a month or a year, in which moment they can achieve there it is a delay of them, we can sure it. Then management, how we can manage the CP children, how we can management to the treatment in this patients. Cerebral palsy, no cure, we can't cure it in fully, but yearly and ongoing we can multidisciplinary care improves to outcomes. So we can maintain to the further complication or further developmental of the science. We can stop it to maintain that one. Physical therapy enhance the strength. Physical therapy, we can give it the physiotherapy treatment to strength, the flexibility and movement, prevents and contracture and joint problems. Then occupational therapy improve daily living activities. It's a daily active daily life. They can do it the eating, dressing. With speech and language therapy improves the communication and swallowing. Speech and language therapy improves the communication, and speech therapists they can train the children. It will helpful to improve the communication skill and the swallowing. It's very easy to swallow the food and the hard things. It will be very easy. Then medication and septic drugs is to prevent the infection. Then anti-seizures medicine. When they affected the seizures, there is a fits problem. They can convulsions. They can take it to the anti-seizures medicine. It will control the signs of the fits. Assistive devices they can use. There it is difficult to movement is a weakness of the muscle, then is stiffness in the muscle, it's floppy, we can use it the assistive device. These are the things we can do it to maintain the muscle power, to reduce the muscle loss, to braces, walkers, wheelchair, and the communication devices. Surgery, orthopedic surgery to correct the deformity, selective dorsal of the reduce the spasticity. Yes, surgery orthopedic sometimes a tightness to relieve the tightness to maintain posture and we correct the deformities to get the gain the movement very easy. Then special education support service, individualized educational program and psychological counseling and child and family. The children and the family, we should give the psychological counseling. They know the condition, they want to know the knowledge about the condition, and they can do it, and we will explain them, they understood, and do it the further improvements and to prevent the complications. It will be very helpful to get the next. Then prognosis. Prognosis means lifespan. Main individual with mild CP, live normal, near normal lifespan. Severe forms have been reduced life expectancy, and depending on the complication, they can try to do it to the children independently. They can achieve some daily life, active daily life survey. We can teach it and do it related to that one, depending on the complication. So prevent the dependent to others or the associated one to prevent them. Then mobility. Some children can walk independently while others need assistive device. Mobility. Some children can walk independently. Most of them we can train it in the physiotherapy or the speech therapy and the other associated medication and the contracture surgery. They can do it independently. So most of some rare conditions they need to assistive device in the wheelchair, and then other support they can do it the auxiliary crutches, and these things they can use it and do it the mobility. The independency with their therapy and support, many individuals lead fulfill and semi to fully independent life. The independence according to the severity, they can do it in the individual or the independency. They can. Then prevention, how we can prevent without get to the CP, how we can prevent this condition from this condition. Good parental care, when they conceive, that time we can give it the proper consulting, then health care, other things. Moreover, they can care the parent, the woman, if there is any infection, they can control and cure that one. Then we can give it the good parental care to prevent from this the issue. Then infection control during prevention. Sometimes they will be affected the infections. They can do it the following doctor to do it the meditation to prevent the infection that time. Then proper management in high pregnancy, and then 3 months once, 2 months once, we can check up and go and see the doctor. If there is a high risk factors, they receive them advice to prevent the high risk pregnancy, high risk pregnancy to prevent that. Then avoiding the birth trauma during the pregnancy, we carefully care the woman and the to do it very carefully, mobility and other things to prevent the trauma from the brain, in the brain. Yearly detection and treatment and neonatal condition. When we see to find out the any condition in the neonatal period, we can do it and give the proper treatment to these are the major prevention. So let us see the cerebral palsy and the types of the palsy, Then what are the types? There it is a changes. What are the signs and symptoms in the different types of the palsy? Then what are the clinical features and the management and prevention? These are the things we elaborated, discussed in the conditions. So thank you all. You are going to refer and book also. You can gain it, get the good knowledge. Thank you all. Thank you.